I'm Maria Smith, president of the Friends of the Shrewsbury Senior Center. Welcome again. And we have a whole panel of experts on very, very important topics that are going to give you some valuable information. From private pay home care, accessible home health care, and Shrewsbury Nursing and Rehab Center, we have Lynn.
I'm wearing two hats today.
She's wearing two hats. She multitasks very well. From hospice at Notre Dame Hospice, we have Patty. Thank you. From assisted living, Orchard Grove of Shrewsbury, we have Melissa. And from PACE, Fallon Health Summit Elder Care, we have Sharon. So welcome them, and we'll get started with our program.
Okay, great.
Thank you.
We can project. You can hear us well?
I'll put it here, and
Okay.
if you need it,
Yeah,
just
I
push
might
the
need it.
Sure.
button.
Okay.
I don't project.
So, thank you so much for coming today. We appreciate it. We hope you all had a nice holiday yesterday and getting ready for snow and rain this week, right? In April. Only in New England. So, we represent organizations that have been in the industry for many, many years. And we're going to talk about kind of, nursing home 101, hospice 101, assisted living 101, PACE program, as well as home care 101. And we will talk and have questions. If you have questions, we can answer them. We can do it during the presentation or at the end, whatever you feel comfortable with. So we're going to talk about home care. As Maria said, we're going to talk about the two different levels of home care, be it private pay and also Medicare certified, which means insurance pays for that. We're going to talk about nursing home care, assisted living, hospice, and the PACE program. So I'm going to start off with talking about home care, because it's kind of the level of as we age and we need help, we usually start off with home care. So home care in Massachusetts, there are about 400 or 500 private home care agencies, and there's about probably 380 Medicare certified home care agencies throughout the state, going from the Berkshires to the Cape. So today we're going to talk about the two different kinds. One is what they call VNA. Everybody's familiar with that term. That's a Medicare certified home care agency. And that means that your insurance pays for it. So if you have Medicare or you have maybe supplemental insurance, be it a Fallon or a UMass or Blue Cross Blue Shield, they pay for your level of care. When you are receiving at your home, and your home could be at your daughter's house, your friend's house, your condo, wherever you are, it could be an assisted living, it could be in a nursing home. When you receive care through the VNA, through Medicare certified or VNA, you would need to stay at your home. You cannot leave. So let's say they come in and do nursing comes in, they send an aide a couple days a week, they have physical therapy, maybe occupational therapy or speech therapy comes in, and you're receiving those services at home. After they leave, you can't get in your car and drive to the grocery store. Right? When you're receiving Medicare certified home care, you need to stay within your home, unless you're going to visit a doctor's visit, office or what have you. So you can't receive services and then be out and about. So usually home care is made up of a few components. So nursing, number one, physical therapy, occupational therapy, speech therapy, and home care aides. And they can be certified nursing assistants or they can be certified home health aides. And they come to your house and they help you with your activities of daily living. Most of you have heard the acronym ADLs. That means activities of daily living. And that covers toiletry, showering, bathing, dressing, eating. Those are kind of your activities of daily living. So with a certified agency, they'll come in and they'll have a nurse come in, and then they'll do an assessment on you, and then they decide what care that you need. Let's say you fell and broke your hip, and you went to the hospital and you came home, and you're going to need physical therapy, occupational therapy, and you're going to need nursing and an aide to come in and help you. That's going to be covered under your insurances. And it's all based on your diagnosis, your progress, and what insurance you have, and how long that will cover. It could be a 2 or 3 week, maybe a month period. It depends on, again, it's insurance driven. The other option for private home care agencies is that insurance does not cover it. When they say private, that means that you pay out of pocket for that care. Do any of you have long-term care insurance at all? Okay. So some long-term care insurance policies, there's about 5 left in the country, and they will cover a percentage of home care. They may say we'll cover, $100 a day, or we'll cover nursing home care, or we'll cover assisted living care. So with long-term care, each policy is different, depends on what policy you purchased and the premiums that you pay for. But mostly with private home care agencies, there is a component so the long-term care would pay a percentage of your care. And with private home care agency, we come in, we have a nurse on staff, especially at our agency, Accessible Home Health, which is based in Auburn, Mass. We're owned by a nurse. We have a nurse come in, they do an assessment on you, they develop a care plan, and that care plan is followed by the aides. So it could be a CNA that comes in to help you with your activities of daily living. It could be a certified home health aide that comes in. There's a little difference in schooling, what they had to go through to be either a CNA or a home health aide. And the nurse can come in also and, help you with your medication, your wound care, what have you. In private home care, there are 2 components. It's usually a medical-driven or non-medical. Accessible home care happens to be medical, which means we have RNs on staff. They oversee the care that you receive. They do an assessment. That care plan is developed from the assessment and followed by the aides and changed when you progress, or in other words, maybe if you're not, it would be changed to work with what your diagnosis is. So private home care, they can come in. They'll have a minimum of hours. So at Accessible, we do a 4-hour minimum, and we can do live-ins, which means someone would come and actually live at your house to take care of you, and which is nice because you have one person all the time. And 24/7 is another term that would be used. That means that you usually have 2 different staff members that come in and do 12-hour shifts. So there's someone there all the time, as well as a live-in, there's someone there all the time. So, and sometimes when you come home from the hospital, your care is greater, so you're at this level because you haven't cut back to, let's say had surgery, you're in the hospital for 3 or 4 weeks, maybe you went to a nursing home, and then coming home, so you haven't been home for a while. So to get back to the level that you need to be, it could be that you have to have a lot more care at the beginning, and then you can always decrease the hours as you progress and get back to your baseline. Questions that you have about home health at all? Yes?
Now, what happens if it's not yourself but a spouse?
Mm-hmm.
And so the other spouse is required to, even if somebody comes in to help medically,
Mm-hmm.
can they also come in, even though there's a healthy spouse, to do housework and stuff?
Yes, so with the aides, besides helping you with your ADLs, they can do light housekeeping, light meal preparation, light laundry. They can also, some of the aides drive. They could drive you to follow-up appointments, doctor's appointments, or whatever. If you're going with a private home care agency, you do not have to stay within your home setting because you're paying privately. So you could go to Macy's down at the Solomon Pond Mall if you wanted to, or Market Basket.
I understand that.
Mm-hmm. Yes. Did that answer your question?
I'm not sure.
Okay.
Because we just went through a hard winter with my husband.
Mm-hmm.
And he's 86, I'm 83. I'm able to handle things. I was able to handle it.
Right.
Just barely, but I was able to handle it. Had it been worse,
Mm-hmm.
would I have been able to get the, not only medically, but in terms of, say, shopping or something?
Mm-hmm.
Like maybe the bathrooms need to be done.
Right. Well, that's what I said,
Yes.
light housekeeping, light laundry, shopping, light meal preparation.
Now, would that come under the heading of VA?
That would come under the
VNA?
heading of a private home care agency. The VNA, when they send out an aide, they're really gonna help you with your showering, your bathing,
Okay.
that type of thing, so, yeah.
Yeah.
Yes, I'm sorry?
Question about how difficult it is to get the personnel that you need for
Mhm.
positions. I keep reading and learning.
Right.
I mean, that's across all
It
industries,
is.
but I know
Yeah.
that it's been a long-term problem.
There has
for-
been a shortage, unfortunately, in this industry from primary care physicians. Try to get a primary care physician these days, right? They're all going to specialties. So to get a primary care physician to nursing to aides, it is, I think, we've been in business 6 years, and a lot of our staff has been with us for 6 years, so, which is nice. We do advertise like everybody else for aides. There's a large screening process that they have to go through. They have to, obviously have their certification. We happen to do a CORI check, which is acronym for CORI is the real word is criminal background checks. So we do nationwide background checks. So to make sure that, if someone's coming into your house, we know that they're safe, they have not had something happen in Rhode Island. If they did, it would be picked up on a national CORI check. So, but I think we're always gonna have a shortage in this industry. It's unfortunate. And then when COVID came along, that really did a lot of nurses retired. They were, so stressed and overworked that they left the industry. So, there was just an article in the paper the other day, if you speak to a hospital, they say one thing. If you speak to a nursing home or a home care agency, they say different things. In regards to recruitment, everyone's trying to recruit, as we all have, and continue to, and strive for the best staff that we can get.
You mentioned 2 types of home health.
Home health care?
aides. Can you repeat what they were and explain the difference, please?
Sure, so one is private home care, which means that you pay out of pocket.
Right.
Private
You
pay.
mentioned
Means
they
home
would
health
have
aid
additional-
from CNA. CNA versus home health
CNA,
aid.
certified nursing assistants,
Yeah,
and HH is certified home health aides.
so what's the difference between what they can do?
It's just the amount of schooling that they've done to get their certification. Usually they start off as a companion, then they move into certified home health aides, then they go to school and take the exam to become a certified nursing assistant. And a lot of CNAs have gone on to become LPNs and RNs too, which is nice. You're welcome. So the difference in private home care versus the VNA, everybody kind of understands, one is paid by insurance, one is paid privately. We also private home care agencies work closely with a lot of the hospice companies, which Patty will talk about afterwards. But a lot of times when a family member goes on hospice and someone needs to be there, let's say 11 p.m. to 7 a.m., and you can't be as a caretaker, we can come in and help also. So, and we stress for people that are caretakers. How many in the audience are caretakers for their loved ones? Yeah, it's a very, very stressful position. You don't see that on your resume, right? You don't get paid for it.
No,
No.
you signed up better for work.
Yeah, absolutely. In sickness and in health, right? Yeah. But being a caretaker is very, very
yes.
difficult job. It's the hardest job you'll ever do.
We've got a question, Lynn, over here.
Yes, I'm sorry.
I'm just wondering, I've used your services,
Mhm.
and it seems as though 4 hours is the minimum.
Mm-hmm.
What happens if the care does not require that many hours? You still are charged for 4 hours, is that correct?
A lot of companies now have moved the 4 hours up to 8 to 10 hour
But
minimum.
that's what's accessible?
We do 4 hours, yep.
Okay, so there's nothing like 2 hours?
Sometimes there is some flexibility if we have staff availability to be able to do that, but that's very seldom, but sometimes it does happen. Because the staff sometimes they'll do 4 hours at someone's house in Shrewsbury, they have another 4-hour shift in the afternoon at someone's house in Grafton. So, depending on the availability, but we are minimum of 4 hours, but I do know most of the agencies in the area have increased, and they're anywhere now from 8 to 10 hours minimum. So, but in those 4 hours, they're helping you with your ADLs. They can change your bed linens. They can do the laundry. They can do, cleaning out your refrigerator. If any of you have ever been in the hospital and had to go home and you were, not home for a couple weeks, that refrigerator needs to be very thoroughly cleaned out. So, they can do numerous things also. So, yes.
Yeah, I live in an over 55.
Okay.
If I had to have a nurse come in and she was a robust 50, how would that affect the over 55 thing,
It wouldn't.
It wouldn't.
It wouldn't.
doesn't affect, the
She won't
age
be a
does not
resident.
affect where you live.
Yeah.
Okay, so if I needed a 24/7 nurse, she could.
She could still come in no matter what age they are. I mean, you know, they have to be of legal age, but, to work, but, yeah, it doesn't affect your standing of, 55 plus or assisted living.
Yeah.
We work closely with a lot of the assisted livings, including Orchard Grove. We can come in, because we're a medical model, private pay, we can come in, we do IVs, we do wound care, we also do insulin injections. So if someone's a diabetic and can't do their own insulin, our nurse can come in and do the insulin injections too, So questions on anything regarding home care, private, or also, we're also here afterwards if you want to come personally and talk to us. Please feel free. Yes?
Do you have to sign any kind of contract? Do you have to guarantee a certain amount of
No,
time?
it's a service agreement basically for private pay, and that basically says that we're gonna give, Sophie it's gonna work for you for these many hours, and we are gonna get reimbursed at this, and that's all it is. It's not that you have to be with us for 2 weeks or 4 weeks or whatever. And the same with a Medicare certified agency, there's no contract there. So, because it's based on insurance driven, so. Great. Yes?
On an as-need.
As needed basis. So usually what most private home care agencies, unless it's an emergent situation where, you unfortunately went to the hospital again or something, we ask just if you're gonna, cancel out or change, we ask for a 24-hour notice, because we have to tell our staff, obviously, and rearrange our staff to go to, service somebody else.
If someone is receiving you said you had to stay in your home.
When
So
you're,
for
when
like
you're under
doctor's office.
Medicare certified agency.
Right, but what I was wondering is, like, let's say there's a family function that they want to take grandma and grandpa to, would they still have to stay in their?
I would bring that up to the certified agency to see what their flexibility is. It's a Medicare ruling, it's not,
Okay.
yeah, it's a Medicare rule, it's not the agency's rule.
Okay.
Yep. Great. I'm gonna pass this on now to Sharon. Sharon's actually from Shrewsbury, and Melissa's from Shrewsbury. They both grew up in Shrewsbury. Sharon still resides in Shrewsbury, so she's gonna speak about the Summit PACE program, which is very interesting.
Has anyone ever heard of the Summit Elder Care PACE program? Okay. Can everybody hear me all right?
Yep.
Okay. So I work for Fallon Health, and Fallon Health has many insurances, and one of them is Summit Elder Care. And it's a PACE program, and it stands for Program of All-Inclusive Care for the Elderly. We have 5 locations. The closest one to Shrewsbury is 288 Grove Street. We're also in Leominster, and Lowell, and Webster, and Springfield. So we cover most of Massachusetts. And we actually will be building a new PACE program in the south area, southeast area. So covering parts of the Cape and that area. So that's new news for this year, the end of this year. So basically, these PACE programs are, again, programs of all-inclusive care for the elderly. I gave you brochures, and I'm going to kind of go by the brochure, so I'm actually on the left-hand side, and I'm just going to talk to this so you'll be able to circle it or write in notes. But it is an insurance, again, and it includes the geriatric physician. So you do change your physician to the physician at Summit. And it's also, we have PT and OT, occupational therapy, physical therapy, and we also have speech therapy. And we have a dentist that comes in, we have an optician that comes in, and we also have a podiatrist that comes in to Summit. And Summit also is an adult day health, so people are able to come into the adult day health, have activities like crafts or music, entertainment. We do exercise, we have a hot meal, and we can transport them back and forth to Summit, to the adult day health. Some people are not interested in that piece, but many people are. So it really depends on what the needs are and if people are interested. So they can attend the adult day health. And we have anywhere from 70 to 75 people a day there. It's busy, it's fun. But we also have social support. So we have social workers on our staff and, of course, the social support from the adult day health. We have, again, it's hospitalization, and it gets a little bit confusing, but if somebody were to get these services at no cost, and their income would have to be under $2,829 a month, and they have to show less than $2,000 in assets. Now, for the PACE programs throughout the United States, the government allows people to move money out of the person's name, but you have to show Mass Health what you do with the money. So if I transfer $5,000 into my name from my mother's account, we have to show that if we're going to get her onto Mass Health. Gets a little bit involved, but I just wanted you to know that it is allowed with the PACE programs. Okay? But the income has to be under 2829 of gross income. If it's over that, then there's co-pays. It gets a little bit involved with how the co-pays work. If somebody wants, I can explain that after. Okay? But most of the people that are on the Summit Elder Care program are receiving these services through Medicare and through Mass Health. And we, Fallon Health, help them get on to Mass Health. So we do all the paperwork, all the Mass Health paperwork, which is really, it's involved. And then we work directly with Mass Health to make sure that they have everything, and we send everything. Lately, what's happening with Mass Health is they're asking for a lot more documentation. So they're delving into the background and asking for more paperwork. So we gather all the paperwork and send it off. Okay? So basically, the eligibility is in the green area on the brochure, but you have to be 55 years or older and needing help with 3 activities of daily living. And again, we're talking about ADLs, just like Lynn was talking about. So you need to have 3 ADLs. Now, we say enough assistance to qualify for nursing home level of care. And a nursing home level of care would be like if someone needed help with medication management or diabetes management or has memory loss and needs cueing. So that's what those particular words mean. So don't get nervous about that. One thing is that if people are interested in our program, they really have to be safe in their own home. They have to be able to leave the house. Sometimes you hear of people that are not able to leave the house. So they have to be considered safe. They can't be, turning the stove on, starting fires. I'm just saying they have to be considered safe. In some cases, when we are working with family members and the elder is not safe, then we can make suggestions, because we work with different housings where we provide 24/7 care in the housings, and we also work with some assisted livings, and we pay for the care at the assisted livings. So there could be a possible situation where they might want to do, move into the housing or the assisted living, and then be safe, be considered safe, and then be able to get on to Summit. I know it gets a little involved. We also have, and I explained this already, but the social workers and the OT and the PT and the rehab. We also have a dietitian on our staff, and of course the geriatric physician, the nurse practitioner, and social workers. So the whole staff works together to make sure that the individual is receiving the care that they need, but also they're dealing with maybe some mental health or some dementia or physical problems or anxiety. There's so many different things that individuals are dealing with, and it's not just, memory loss or not being able to walk or just many different situations. So the team works together to make sure that they get all the services that they need. It makes it easier, too, for the families who have people on the PACE program, because we can manage the doctor's appointments and the transportation and, actually go into the home and help them in their home, too, with the OT and the doctors. So it does make it easier for the family, because we can case manage the person.
And you have aides, too, that go in the morning if they're going to the adult day
Yes.
division, correct?
And what's happening, again, you had mentioned, or there was a question about the home health aides. And so what we're doing is we are sending our employed home health aides out in the morning and in the afternoon, and then they're there during the day at the adult day health. So they're going out in the morning and the afternoon. So it's helping us with the problem that's out there with the home health care agencies. I'm trying to think. One more thing that's important to say is that we have 24-hour access, or the individuals have 24-hour access to a nurse in case there's a problem. So that's you know, that's very important. Because sometimes there's people that are calling 911 and sometimes there's not a need. You know, sometimes there is a real need, but sometimes people are constantly calling. So you'll see less of that. Another thing that we also have is we provide mom's meals or Meals on Wheels, and we pay for it, and we have it sent to the home. I'm trying to think if I forgot anything. That's good. Does anybody have any questions about the PACE program? I just wanted to say, and I don't know if I said this, but there's 8 of these PACE programs in Massachusetts, and there's over 150 in the United States, and we are the largest in New England. And I've been with the company for 15 years. Thank you.
Any questions? Again, we can, talk individually after the session is finished. But at this point in time, we're going to go over to Melissa. And Melissa represents Orchard Grove Assisted Living, which is kind of the newest assisted living in this area. Now you're almost a couple years old. But they're right on Walnut Street off of Route 9 in Shrewsbury.
So my name is Melissa, and I work for the residents at Orchard Grove. We are the newer kid on the block. We've been open for about 6 years. Our parent company, LCB, has been open for about 30, and they're smaller, so they only have senior living communities on the East Coast, and we're a little bit different. So how many people think that when you're thinking about a senior living community, it's about taking things from you? About not being able to do the things that you've always wanted to do? If that's what you think communities like ours, like mine is, that is absolutely not it. It's about living a better life, an easier life, where you don't have to worry about shoveling, you don't have to worry about cooking, you don't have to worry about mowing the grass. But what you do have to worry about is making sure that you make cocktail hour at 3 o'clock if you want to, or hopping on the van to go to a play, or deciding what you're going to have off of the everyday available menu made by our culinary gourmet chefs. Orchard Grove is a wonderful community, and I feel like I gush when I talk about it. 98% of the residents that come to live with me want to live an easier life. It may not be because they need any physical support. I can provide that. But they're missing that part of their lives where they had neighbors and friends, where it's not so easy to see other people. So they want that sense of community. They want that sense of involvement, other people to look out for them, and to know that they have that support if and when it's needed. We have independent assisted, and we also have our Reflections community that is for Alzheimer's and dementia. It's really nice because we do consider ourselves one community. Even though some of my residents may have dementia or Alzheimer's, they're still a part of our residents. They still enjoy yoga class. They still enjoy Tai Chi. They still have the benefits of all the wonderful meals. But from day to day, they get that support they need, all the while refinding their purpose. We have a variety of things going on, from outdoor activities to plays and going to casinos and the newest wineries and the newest restaurants that open on Shrewsbury Street to musicians coming in. Our dining rooms are open from 7 a.m. to 7 p.m. with a full choice of a 10-page everyday available menu. It really is a wonderful place. We understand that getting older is harder, and we're here to make it easier for you, to take away the stuff that's starting to become more difficult, and we'll take care of that for you. So I do invite you to come in and check it out. It sounds great when I gush about it, but seeing is believing, and our doors are always open. We welcome you to come in for lunch, stop in for dinner, come for cocktail hour. It's every day at 3 o'clock. But we'd love to have you. We do partner with the Senior Center a lot, and with the Friends of Shrewsbury. So come and check it out and see what the residence is all about. We'd love to have you.
Melissa, could you explain the difference between some of the assisted livings out there? There is a fee to go into the building, to move into the building, and then there are others that don't charge an entrance fee.
So when you start looking at senior living communities, there are what we call CCRCs, And then there are communities like ours, which is a independent assisted and a memory care community. A CCRC like the Willows of Westboro, Southgate, is where you pay a buy-in. You actually buy the apartment you're going to live in. And they are an independent, they were built, I used to work at Southgate in my younger days. They were built for independent living. They can provide a certain amount of care, usually up to an hour. After that, you have to hire your own care to come in. Most of those communities do not have a memory care attached to them. They have a skilled nursing, such as Shrewsbury Nursing and Rehab, but no community that deals with cognitive impairment or dementia. Communities like mine, you don't buy in. You pay a one-time fee, which is either equal to 1 month's rent. Some communities are $6,500. You pay that one time, and it's a rental. It's a month-to-month lease. But communities like mine can provide nothing for you, or as you move along to your tomorrows, we can provide things full scale. We can go from, dressing assistants, shower assistants, cues and prompts, medication reminders. If you need escorts, transfers, we can run that full gamut, as well as we do have a secure memory care neighborhood should it be needed. It's not always needed, but sometimes it is. And those are really the primary differences. It's about going out and seeing some. Don't wait until you need it, till you're in a situation where, oh my God, I have to make a decision in a day. When you don't need it, go out and explore. I always say pick 3. Whether you're looking for hospice or you're looking for, home health, take 3 of them and go visit. Because it's not about the beautiful chandeliers and the gorgeous curtains. It's about the residents that you're going to meet. It's about the team that you're going to meet. Are they happy? Are they smiling? Are they friendly? And when you walk out the doors, what I want you to say, I could see myself here. That's your aha moment. Not everybody is going to be right for everybody. So take 3 and don't wait till it's an emergency. Do it now.
What percent occupancy do you have now?
I am at full capacity. I'm 100%. I've been 100% for about 9 months now.
So what is your waiting list?
It depends upon what you're waiting for. Are you waiting for a 1-bedroom, a studio, memory care? And this is what I say, don't ever let a waiting list deter you. Because I have several people on my waiting list that when I've offered them an apartment, they weren't quite ready that month. They wanted to wait till the next month. So I go to the next person. So when I say I have 4 people maybe ahead of you on the wait list, those 3 people ahead of you may decline my offer, which is going to put you right up to the front. So
My next question, and just because I had some friends go through this recently,
Mhm.
they were making some changes.
Sure.
In their lives. Is it smoke-free?
My community is smoke-free, yes. You're not allowed to smoke inside of the community.
And technically, they were in a smoke-free environment, and the people below them were smoking not just regular cigarettes, but cannabis and everything else.
Yeah, no.
Now, this was not a senior center, this was actually an apartment.
Oh.
Oh, okay.
But
Uh-huh.
They had to leave because they couldn't wait for the time for the landlord to evict them.
Yeah, no, we are an absolutely smoke-free environment. We have to be smoke-free. I do have, I've not very many, but I have 1 or 2 that may have oxygen in the building. If I have a resident, we do have an area where they can go off of the building if they, I think I only have 1, maybe that. And
It's not intake that takes that.
no, because they're not even allowed on the premises to have a cigarette or a smoke. They have to go off of the building. So no, we are totally smoke-free. We're regulated by the EOEA on that, so we are not allowed to have that for various reasons. So yeah. Mm-hmm.
What happens if I need a hip replacement and only need, temporary help?
That's fine.
Or help?
Yep. So let's say, are you at home and you have a hip replacement, or are you living with me?
Or doing respite?
Okay, so you're living with me, you go for a hip replacement. Before the hip replacement, you needed nothing from me, but then you come back, right? So you're gonna go to the hospital, you're probably gonna go to rehab, Shrewsbury Nursing and Rehab, and then you're gonna come back to me, we'll say. And you're still gonna need some help. So companies like Accessible or whoever you choose will come into the community and provide that OTPT. And then anything else that you need from my team, I can help you with. And then as you move forward and you get stronger, I can relinquish my help from you. So that can happen frequently at my place where people may have a fall or they're coming in and they need more support when they arrive. But you know what? They start to eat better. They have more of a sense of purpose. They're doing more things. They don't need anything from me by the end.
When I need help from you?
It depends on what you're needing. So the way our plan works is we're a little bit different. You're gonna go to places where it says, you pay this for that, and this for that, and this for, and then if you're independent, but then you need assisted, you have to move. At our community, you pick your apartment, you move into that, whether you need anything from me or you're totally independent, you can stay right in that same apartment. We have in our pricing some care built in for you. So pretty much your base level is already in there. So if you ever need it, we're not saying, oh, you're assisted now. Nope, you're still independent to me. You just might need some support at that time. The only time you ever move in our community is if you do require more of a secure community such as memory care.
And you also do respite too, right?
We do respite too. So if you're at home and you can't go home after an accident or an incident, you can come stay with us for up to 90 days or as short as 30 days while you're recouping. So, which is a nice option. We'll furnish the whole apartment for you. We'll set up phone and cable. You just bring your suitcase.
And what's nice too, if you're a caretaker and you need to go an extensive summer vacation and you're taking care of that loved one, they can also go and have respite stay there too.
Right. And we do have a lot of spouses, we have spouses that where one may need nothing from me, but they're the primary caretaker of another and it's becoming a lot. So they come together so we can help that primary caretaker, because the most important thing when you're a husband and a wife is whoever you're caring for really needs you to stay healthy, right? They need that from you. And when you're not able to care for yourself, that's when it's time to kind of rethink that. And we see that a lot. So we can help everybody, body, mind, and spirit. So, yeah.
Is there an age criteria?
So most of my residents are above 65, but I'm going to tell you, I do have a couple of residents that they're about 58 for some reason. And so really it's the need. But above 65, my median age is probably mid-80s. But I have residents there that are 96 and don't need anything from me. They're just there for some friendship and, they were isolated at home. And life is meant to be lived with people, right? Different things to do. Try something you always wanted to do. This is your chance.
Great. And we all say the same sentence, be advocates for yourself. Plan ahead. Again, crises occur and all of a sudden, your loved one that you've been caring for ends up in the hospital, and then, the case manager at the hospital is saying, your loved one's being discharged in 2 days. What are your plans? And you go, So plan ahead.
Right.
Don't overwhelm yourself. If you're going to look at assisted livings, you have quite a few in town, which is nice. But as Melissa said, choose 3. Don't overwhelm yourself.
Right. And your better ones are going to be full. Shrewsbury is a great area. I grew up in Shrewsbury. So the ones that you may like may be full. And most of these wait lists for the ones that doesn't mean that you're looking for tomorrow, but you can be on their call list so they get to chat with you or invite you to an event just so you know where they're at and what's going on. So.
Any other questions regarding assisted living? At this point in time, I'm wearing 2 hats today, so I'm going to speak about nursing home care. So I represent Shrewsbury Nursing and Rehab, which is on Julio Drive in Shrewsbury. It's family owned. It's over 50 years old. And there's about a couple hundred nursing homes throughout the state right now. A lot of them are owned by national companies. There's probably about 5 of us in this area that are still family owned, which is nice. And that landscape changes daily. So let's use the scenario. Unfortunately, you fell, broke a hip, you went to the hospital, you had surgery, you aren't able to go home yet with home care, are not able to go back to assisted living that you were living at. So you need to go to a nursing center for short-term rehab. And that usually is based on a couple weeks of physical therapy, occupational therapy, speech therapy, nursing, what's needed. So if you're in the hospital and you had surgery, or you've been on a gurney in the ER for a couple days, you need to make sure, that you
True.
are admitted. So Medicare requires 3 midnight stays for you to go to a nursing center. That was waived during COVID, and now it's back, it's instituted back, and that's Medicare ruling, that CMS, which is Centers for Medicare and Medicaid. Medicare does require you need 3 midnight stays. You have to be admitted, you're not under observation when you're in the nursing, in the hospital, because you cannot go to the nursing home under observation unless you pay out of pocket yourself. It's not gonna be covered by your insurance. So Medicare, most of you have Medicare, correct? And then maybe a supplemental income, maybe a supplemental is for, like a managed care, Fallon or UMass or Blue Cross. So if you're going in under Medicare to the nursing home, days 0 through 20 you're covered at 100% by Medicare. Days 21 to 100 are covered at 80%. So either if you don't have a supplemental managed care company as a secondary insurance, you would have to pay that difference, and that's usually a couple $100s a day. Or if you have a Fallon, or you have a Blue Cross Blue Shield, or you have Tufts or United, they would pay a certain percentage of that. Medicare is paying 80, and then you would have to pay the additional 20. So you're covered, and when you go to a nursing center, you're gonna receive nursing care, you're gonna receive PT, OT, speech, your meals, your medication, your oxygen, everything that you could possibly think of. Most of your nursing homes now have either a single room or a double room. So you either have a roommate or you're pretty much by yourself in a private room, which is nice. Most of the nursing homes, or all the nursing homes in the state, go through state surveys, and a survey team comes in, and they look at everything from food to maintenance to charts to talking to staff, talking to loved ones that are visiting their loved ones. And it's all done on a rating system. So your rating system goes from 1 being the worst to 5 being the best. 5 stars or 1 star. 5 stars are the best. Not many nursing centers can say that they have a 5-star rating. I must say Shrewsbury Nursing Home does, and Rehab Center does have a 5-star rating, which is quite nice, and it's very hard to achieve that, and even harder to maintain that. So when you go, and you can go on the mass.gov online and look, and they will list the rating of all the nursing centers throughout Massachusetts. So please look for a 5-star versus 1 star, 5-star being the best. So when you go to the nursing center, you could be there temporarily, or if you have someone that has dementia or Alzheimer's and you've tried everything in the system and now it's time that you think that maybe they need to go into a specialized memory unit, which is usually a secured unit, which means they have a higher ratio of staffing, the activities are different, the colors, everything is different within those units. Not every nursing center throughout the state has a specialized nursing memory unit, so you really need to check. And again, we say, as we've been repeating ourselves, to go in and tour nursing centers. Choose 3 of them and go in and tour. Their survey results are always kept right in the lobby, so you can read through the 3-ring binder if you want to see how they were evaluated. And the surveys are done usually yearly. During COVID, it was more like every 2 years, but yearly they come in unannounced, where they walk in on a Saturday morning at 7 o'clock in the morning and start looking at everything. So, all parties on staff have to come in, and they're usually there for 5 or 6 days, and they come in with like 4 or 5 people, and they go through everything thoroughly. So it's quite an interesting 5 days while they're in your building, needless to say. But if you're prepared and you have great staff and you have high functioning levels of PT, OT, nursing, there is usually not a problem, which is nice. So again, I recommend that you go to different nursing centers, walk in unannounced, say you'd like a tour. You're looking for the future, or you're looking for your caretaker, and you're looking, or as Melissa also mentioned, sometimes the memory units, the average person with dementia or Alzheimer's starts out maybe dementia and then progresses into Alzheimer's, can live with the disease for 20 years. So it's not unheard of for someone being diagnosed even early onset in their 50s, and in their 70s now, they've, maybe going to their 20th year of having this diagnosis, and at that point in time, maybe they need more care that can be offered at home, so that they need to go to a memory unit. So you want to make sure that you get your name on a wait list, because the only way that the memory unit has an opening is from, when fortunately someone passing. So if you have caretaker of a loved one that has the disease of Alzheimer's, I would suggest that you start looking at nursing centers and get your name in on a wait list also. And there's other insurances too, like Medicaid. If you have Medicaid, that's usually when someone is permanently living in a nursing home. That would be an insurance they would have. Usually the business offices or specialty elder law attorneys that will specialize in doing Medicaid applications. It's the process is unbelievable. They look back 5 years. Medicaid looks back 5 years at all your funding and all your assets. So when people say they're moving this and they're moving that, if it's been past 5 years, you're pretty much safe. If it hasn't been, we had someone one time say, well, I took my family and we all went to Foxwood and spent $10,000. Yeah, that's not gonna work. I hope you won. But they look at everything. They look at all your bank assets, all your bank accounts, anything that you have, annuities, whatever, that's all taken into effect to go on Medicaid. So, and it's quite a process, so. I suggest if nobody has done a will or a trust, to work with elder law specialists to get that. It's nice that you have an attorney that's your friend that maybe helped you closing at your house, but they're not an elder law specialist. You really need, with the rules and the regulations that change with Medicare and Medicaid, you really need to deal with an elder law specialist. And there are quite a few in this area. We're blessed that we have choices where we live. We have some of the best hospitals in the country in this, New England marketplace. So we have great options, and again, plan for those options, because the crises always occur, and then you don't know what you're gonna do, Unfortunately, your mom or dad is in the hospital, and then they're saying they're discharging, what's your plan? And if you don't have a plan, you have to put something together really fast, and then you don't have choices. You have to pretty much. I always say advocate for yourself when you're in the hospital. It's based on nursing home care, is based on insurances. Not every nursing center covers the same insurances, and also bed availability. So you might want Shrewsbury, and we're full, or we don't have a bed that, in the memory unit at this point in time. So you might have to go somewhere else, but you can always transfer back to another nursing center. You have those options. Questions that you have about nursing home care? Yes.
I know this one has been here for how many years?
50 plus, Shrewsbury?
Okay.
Yeah, originally
And
50 plus.
what is, how many residents can they have there, or how many?
So we are licensed for 99 beds.
Does that include the memory unit as well?
Mm-hmm.
Okay. And how much turnover do you have versus people who have lived there to the end of their days?
It depends on their diagnosis, their age, some people can be there 10 years. It depends on, their longevity. Some people come in and they're there for 2 weeks. That is very hard to be able to trend to say, based on this cancer, you live this long, so it's very difficult. But we have a lot of staff that have been there for quite many years. As you mentioned, most people said they either worked at, the nursing center or somewhere in Shrewsbury or Southgate.
Bowling alley
Yeah,
dishwasher.
bowling alley in Southgate.
I worked there, that was my first job.
Yeah, it's a rite of passage.
So, we've had staff, which is nice, that have been CNAs, have gone on to become RNs and LPNs and are still working at our facility, which is nice, so. Mhm. Other questions that you have? No? Again, be advocates for yourself, choose wisely, and plan ahead. And afterwards, we're gonna go through our telephone numbers and contacts before we end this session. But at this point in time, as we progress, as, you know, things happen in the world, we go to hospice next. And Patty from Notre Dame Hospice, right on the street on Plantation Street, will be speaking about what hospice is and what palliative care is and the difference.
Thank you.
Do you need that microphone?
Yeah, probably.
Yeah.
I don't know how loud I am.
Okay.
Can you hear me
Patty's
without
the
it?
quiet one of the three of us.
You have to turn on.
Yeah, we can project.
Let me see
our
if
voice.
you can hear me without it.
Can you
No,
hear her?
I'll use the microphone.
Push the, so that the green button goes
Oh,
up.
Okay.
that's better. I'm not good at yelling. No, you weren't yelling, but you projected better than I did. So, thank you for introducing me, Lynn. As she said, I'm with the hospice and palliative program that is overseen by Notre Dame Healthcare on Plantation Street. Yes, they save the best for last. And I think, you know, that makes people laugh, but truly hospice, it's a hard word to hear. It's a hard word to say. It's a hard word to think about. And two things to that. One is a lot of people like to use the word palliative care. And palliative care always did also mean comfort care. So hospice is comfort care, hospice is palliative care, palliative is hospice. But in the eyes of insurance companies, it is very different things. Hospice is regulated by CMS, the Centers of Medicare and Medicaid. So like Lynn said, there's regulations, just like a nursing home has regulations, hospice companies have regulations that they have to follow. Palliative care programs, it depends. There's no real one program. A lot of people have them, but they can be set up differently because they are not as strictly regulated. They haven't come up with a plan yet. It's like the Wild West in a way. It's something that is absolutely necessary and needed, but there's not a lot of reimbursement for it. So we're all trying to figure it out. So when you hear the word palliative, ask that doctor or nurse or even family member or case manager at the hospital, what do you mean by palliative care? Please explain that to me. And what exactly are they going to, what am I going to receive under that palliative care benefit? Ours happens to be a consultative service, so ours is like, it's an NP-driven program, and they come visit you in your home. This would be for somebody who maybe is not ready to choose their hospice benefit. They want to continue with treatments for certain diseases, which excludes you from going on to hospice. But the palliative care team can come in and work with your specialist to try to connect the dots and make sure that you are having good conversations around your goals. Because it's hard at the doctor's appointment in 15 minutes to get really deep down into what your goals are. What is the thing that you think is that's important to you that you're trying to get to? And is this treatment getting you there, or is it actually hindering that? So it's really good they're able to have advanced care plans. If this happens, then do this. Give you suggestions, real tips. They're in your home, so they can look at the safety factors, and they just try to keep people from that circle of calling 911 and ending up in that emergency room for hours on end and getting a different doctor who tells you a different thing from the last doctor and gives you a different prescription from the last time you were in, and you get home and nothing has changed. And so we see this a lot with chronic and serious illness, and it's very isolating and very scary. So if you have professionals that can come in and explain and work through things with you and your loved ones, it really makes a difference. And it can really stabilize the situation so that you don't have to make the decisions you're not ready to make. But you can have conversations about when is that time and what is the conversation we all need to have. Now, hospice, like I said, is very regulated. Within that, though, there's a lot of for-profits, and it never used to be that way. Hospice, back in the day, was very much faith-based or neighborhood-based. It was nonprofits. They were small. It wasn't about the money. It was about the care and how to get medications into people's homes that had things like cancer, really severe conditions. And now it's grown to be an industry with many, many, many hospices, and some are national, run by big corporations, and They have a lot of different sites. I love Notre Dame because we're a nonprofit, faith-based, we're right here in Worcester. We have sisters from Notre Dame that sit on our board. So we answer to a board of directors. We have to prove to them that we're doing the right thing, and it's not always about the financials. So we provide things that are not right, that we don't have to provide, on top of the things that we have to provide. We also do something a lot of the for-profits don't do, is we don't just do the basics that the regulations say you have to. The regulations say you have to be seen by a nurse every 1 to 14 days. That is not good care. You need to be seen, at least 2 or 3 times right at the get-go. You maybe, if you're not too far down into the process of your disease, maybe you only need to see the nurse once. She calls you a second time. But as things progress, you're going to need to see her maybe up to daily, 7 days a week. We have to be ahead of all symptoms. We can't let you be chasing and suffering and have the caregivers have the weight of, should I, shouldn't I? What about this medication? Should I give it to them? Oh my God, and these things happen in the middle of the night. They don't happen at 3 o'clock in the afternoon. So you need to have 24/7 nurse on call that you can call and ask the question, and they can put you at ease by talking you through it. So that's one of the regulations. The other is social work. We have social workers, and they come in and they aren't just there. Sometimes they're thinking, oh, I don't need a social worker. I've got a lot of support. But maybe you need help filling out, you're wondering, as we go down this road, is my loved one going to need a nursing home? Am I able to give the kind of care? Is it safe for me to give care to this person in my home? So your social workers can help you with that Medicaid paperwork that you have to fill out, or they can help you. They know the social workers in the nursing homes. They can make the phone calls for you. They can make the visit appointments for you. They can help walk you through the process of how to look at a nursing home and what might be available to you. Respite, you're allowed respite. So once a month, you can go to a nursing home. They can do all that paperwork for you, and your loved one can go to a nursing home so that you can get a week, well, it's 5 days. You can get 5 days of respite, whether that's to go to a family's a wedding, whether that's just for you to get your mental health, you get to sleep for 5 days where you didn't get to for the last 3 weeks. So there's a lot of reasons, and that's what social work does on that part. So you need social workers to actually show up, not just call and see how you're feeling. There's a lot more to it. But we do also use them to make sure that we are addressing all your psychosocial issues, life review. A lot of people, there's a lot of loose ends we want to tie up. And so it's nice to have guidance through those conversations. We have, like Lynn was saying, home health aides, CNAs certified, depending on what your needs are. If it's more like we want to make sure that your sheets are clean, that you are groomed, that a man has a nice shave, that the woman's hair is combed nicely, she's wearing, clean clothes. That's what's important, and we have someone who will do that. And they will go, again, it depends on where you're at, but 2 times a week, 3 times a week, 5 times a week. We've had people call us to transfer to us that said they don't have any aides to send us, so we're getting nothing. And that's not against the regulations if you don't have them. We also do music and massage therapy, which is not part of the regulations. We choose to do that because we think it's super important for life review. Again, life review through music, it could be a family that spent Christmases together, and they're not going to make this next Christmas. So we have Christmas in July, and they can sing all the Christmas songs, give each other presents, record things, have memories. It sounds sad, but it's actually quite joyous. And when Christmas does come, that family has something that they can all hold on to. So you don't have guilt that you wasted time not being able to create some memories together. We also have spiritual coordinator, non-domination, so we are open to everything. Spirituality to you could be a religion, but it just could be that you want to connect your mind, body, and spirit and make sure that you're in a good place. We have a bereavement coordinator. She follows you for 13 months after your loved one passes. The reason we do this is because you're going to have your first everything in those 13 months. the first missed birthday, the first missed Christmas, the first missed, those are really, really important times that you want to know you have support when you need it. We do a lot of bereavement out in the community, and I have to tell you, I share this with people because I think it's really important. What I have noticed is that our bereavement consists of more community members than family members of our patients. And I truly believe it's because we've done such a good job in meeting their needs with regards of grief and bereavement, that they're set up to be more successful than people that had crash and burns. They had that last minute, and they don't know if they made the right decisions. They're second guessing their decisions, and then those people tend to have a much harder time with grief and end of life review. So I find it's kind of interesting. We actually provide spiritual care and around grief at Orchard Grove, our assisted living, their assisted living, and it's you can experience grief throughout. And it's not always just the passing of a loved one, but the loss of your driving license, the loss of your independence, the loss of, a lot of things that you're going through it and you're wondering, why am I so depressed? Why am I so, and you're isolated. So it's good to have these kind of programs in the community. We also have a volunteer coordinator as part of the regulations. You are supposed to have 5% of volunteers based on your census. So if you have 100 folks, you have to take 5% and make sure you have volunteers for those folks. That is really important, especially for people that don't have loved ones that live around, or maybe they've lived past everybody else. And so they can sit vigil bedside and hold their hand. They can make sure that that person isn't lonely. And then if it's somebody who's more functioning, they can play, gin rummy, just like, a good game of cards and a cup of coffee and listen to their stories and watch their favorite show. So there's a lot of needs there. And of course, that too went away with COVID, and it's coming back now, 2024, that regulation is coming back. And I don't know how prepared everybody is to meet that regulation. We also participate in, it's called the NHPCO, but the Federation for Hospices, basically. And we have, for 3 years in a row now, hit the five circle quality measures, which we are actually the only one in Central Mass to participate in the program and then to achieve in that program. Within that, I want to mention that hospice goes to where your home is. That could be an assisted living. It could be at the nursing home. It also does include private pay caregivers a lot of the times. And just knowing what your options are, or just looking at your trajectory, looking at what's around you, think about do I even have a healthcare proxy yet? Have I even made my wishes known? And that doesn't mean where you want to be buried. So many people, when I say, do they know your wishes? I want to be in the Veterans Cemetery. That's, I want to be, whatever. That's okay after everything's, that's for that. But what do you want? What is your line in the sand? When has quantity and quality not quite met up? Is that because you can't eat food anymore? I have a father-in-law who's 92. He cannot swallow, he cannot eat food. He does pureed, which he hates, and shakes. But sharp as a tack, tells the worst jokes you've ever heard in your life, loves to hold court, and he still loves life. So you would have thought the line in the sand would have been the food, but he's still able to live on his own. He's drinking the booze shakes, Yes, he has to be careful. He gave up his car. We had to have discussions along the way. But that's still quality of life. But then you could have someone who, it's the dementia, the Alzheimer's, and unfortunately, their body maybe isn't failing, but they're not safe. And it's getting harder and harder and harder to try to make that work. And I went through that with my own mom. And we made decisions in crisis over and over again. And I've been working in hospice for 8 years. And my family's very educated and very loving and super devoted to my mother. But when you have a large family and everyone's, you know, in a different place, so I offer that out to you to say, not everybody gets it right all the time. So you have to have forgiveness for yourself, for your loved ones. You know, kids don't ever want to know anything bad is going to happen to their parents, so they don't like to hear mom talk about what they want. Make sure you find the person who's actually going to do what you want. And, you know, you like make sure they're on the same page with you, because it is hard. It is hard to say you're the one in the emergency room and you have to make the decision. So make sure the person that's in the emergency room making the decision is the person that will be specific with what you want. And, you know, don't be afraid to put it down. That's my advice to you as a person. But also the hospice thing, keep that in mind about the for-profit, the nonprofit, the staffing ratios. Always ask, how many patients does each nurse have? How many social workers do you have? We are way overstaffed compared to the regs. Our nurses never have more than 12 to 15 patients. We have 4 social workers with only 20 patients each, which that is insane. That's not even heard of. So it's a really great program, but it's just hard to talk about. So give yourself permission to be uncomfortable, and, you know, start to, in the back of your mind, maybe just start thinking about some things, maybe jotting it down here and there.
And fill out, as you mentioned, a healthcare proxy. You can get that when you go to your doctor's office and fill it out. And you have a primary person, and then there's always a secondary person too. So if that primary person that you put down can't make that decision, or is out of the country, out of the state, something happens, the secondary person can to make that. And usually when you go to the physician's office, they'll ask you if you have a healthcare proxy, and they keep it on file, and you should have a copy of it yourself.
I also want to mention it's a 6-month diagnosis, typically, quote unquote, because you have to start somewhere. So CMS, as you know, Medicare is part of your Social Security benefit. Primarily, that pays for like 98% of all people that are on hospice, unless you work for the state, and then private insurance will cover it. But that 6 months doesn't mean you're signing a piece of paper and no matter what, 6 months is your expiration date. You can graduate because you got such great services that you end up stabilizing. That situation you thought was going to take you out isn't going to take you out, because we did a really good job. So that can happen. The other thing is we've had people for 2 years, right? We've had people on for years. So, you know, it's not written in stone. It's just that you have to be, we have a medical director that works with the team, and they have to make sure that we're being above board, that you truly do still need us, and then Medicare will continue to pay for it. They don't say, oh, 6 months is up, you're out. They just don't do that. So that's a fallacy. And then the other fallacy is that you have to be in a hospital bed. We go to baseball games with our patients, and we do some stuff that, you know, they've been wanting to do for a long time. So it really depends where you are on the journey.
I think today we just want you to know there's so many choices out there, right? It's not like when your mom and dad were getting older, you went to the home or they stayed at home. There are so many options to explore, and there are conversations to be had, right? So think about what you would like, what works best. And I hear it all the time. Well, I told my mother that she never wants to do this and do that. Right, but we have to think about what are the choices now. So have conversations with your loved one, your spouse, your friends. Go see some of them, because the options are vast and wide, and every community is different. Every, you know, while you have your own choice, I love Notre Dame Hospice, I love Accessible, but there's so many places to explore. So have those conversations, make those phone calls, go in and see them. You know, now is the time. And we hope that when you walk away today, you realize that there's so many options for you for health care. And take a look at them and really explore them and ask the questions and advocate for you.
Absolutely. And just so we have our cards over there, but Accessible Home Care, the telephone number is in Auburn. The office number is 508-859-1644. In Shrewsbury Nursing and Rehab, they do long-term, short-term, and then permanent, as well as memory. And we also have an outpatient rehab department on the campus. So if you had to go for physical therapy, occupational therapy, or speech therapy, you could go there, and it's a one-on-one, which is nice. If you've ever gone in to have physical therapy at different locations, you have a physical therapist that might be treating 5 different other customers, including yourself. This is a one-on-one, which is nice. So it's quiet, and you have that undivided attention of the physical therapist or occupational therapist or speech therapist. And there are also staff, this is the same staff that does the nursing center. So if you were in the nursing center for, a hip fracture, and then you had to go for PT after you got home, you could come there and have the same staff, which is quite nice, makes a big difference. Shrewsbury Nursing and Rehab is located on Julio Drive, 40 Julio Drive in Shrewsbury, and the number is 508-845-6786.
And Sharon Noley, the PACE program, under Fallon Health, the number is 774-232-0412. And call me and I'd love to show you around and give you a tour of the location.
I'm Melissa from the residents at Orchard Grove. My cards are over there with the best numbers to reach me on. There's also some invites at the front desk for our signature series coming up in April. It's a taste of culture. We're going to be having the small little Bollywood dancers that are going to be dancing for us and some samples of Indian food. So no suitcase or passport required. Just come on over. But we would love to have you. So anytime you're in the area, if you want to step by, bring your girlfriends, have lunch. No appointment necessary. Just give me a holler, and you're welcome to have a meal. The food is phenomenal.
Yes.
Excellent.
Yes,
Thank God.
and my information's there, and I passed everything out. We have one main number that's on everything, because we don't do voicemail. We actually have a person answer the phone and get the message to the person who, we never leave a voicemail. We need to know that they're gonna get to the right person, so you just call that number and they'll get you where you need to be.
We thank you for coming.
Thank
and
you.
hopefully
Yeah,
this
thanks,
is
everybody.
educational, and you can come and talk to us on an individual basis if you'd like.